Hi, I'm Dr. Lexi Frydenberg, General Paediatrician. I work both in private practice and have been working at a major Victorian paediatric hospital for over 20 years. I see children from age 0 to 18 with a broad range of medical and developmental issues. Now I'm going to talk about some common conditions that present to us as paediatricians when your child is a toddler, age 1 to 4 years of age. Cough is really common. As a parent, you'll know it feels like your child coughs all year round. Cough's normally caused by a viral respiratory, so a chest infection. But even when your child gets better, the cough seems to persist and linger. Unfortunately, cough medicines don't seem to make a difference, and actually in younger children, they can actually cause harm. Honey has been shown to help, but it's important not to use honey in children less than 12 months of age. It's important to remember that cigarette smoke, even on furniture or your clothing, can make your child's cough worse. Most cough does not need treatment and will get better on its own. But if you're worried about your child, if they're persistent cough waking them at night, or if they're short of breath or unwell, it's important to get checked because there are many reasons why a child may be coughing. Croup. Croup is caused by a viral infection, and your child may start with having a runny nose, sore throat, or a mild fever. But then it progresses to a typical cough, which is usually barking and seal-like, and your child might have a hoarse voice at the time. Most cases of croup are mild, and your child will not need any treatment. But if you're worried about your child, if they're struggling to breathe or they're making a high-pitched sound when they breathe in, which we call stridor, then you need to stay calm and call an ambulance and take them to hospital for treatment. Viruses often trigger wheeze. Wheeze is a noise that we hear in a child's chest. You might hear that sitting next to them, or your doctor might hear that with a stethoscope listening to their chest. If your child has recurrent wheeze, breathing difficulties, and cough, your doctor may diagnose them with asthma. Asthma is one of the most common illnesses we see in children in Australia. And asthma does need treatment. Your doctor might prescribe a medication, a puffer, usually called salbutamol or Ventolin. And in this age group, it will be given with a spacer and a mask. Your doctor will then check whether your child responds to that. Their breathing will become easier and their wheeze will disappear. If your child is diagnosed with asthma, it's really important you educate yourself and anyone who looks after your child about their asthma. What triggers it? What are the signs? What to look out for in your child? And how to treat them. It's important to see your GP and get an updated asthma action plan each year and get appropriate treatment. If you would like more education about children and asthma, you can watch the videos on the Kids Health Information page on the Royal Children's Hospital Victoria website or on their app. One of the most common referrals we get as paediatricians is with regard to children's development. Children develop at different rates, so it's important not to compare your child with other children in your mother's group. In Victoria, we've got a great system where our maternal child health nurses monitor a child's development at different stages. So if your child is not reaching their milestones, either their motor milestones or their speech and language or communication milestones, they need to get assessed. If your child has lost any skills or gone backwards at any stage, it's important to get them checked also. You know your child best. You're the expert, so please get assessed if you're worried.